Good morning, dear students. I am Maram Allam. I'm a lecturer in Pathology department. هكون معاكم هنكمل محاضرات الانفلاميشن. تمام. Lecture 5 في الانفلاميشن هتتكلم على definition, types and pathogenesis of chronic inflammation, and these are the ILOs that will be covered. احنا عرفنا ان الانفلاميشن بيتقسم ل acute is classified into acute and chronic inflammation, والacute بيتقسم إلى non-suppurative and suppurative, and the suppurative inflammation will be subclassified into localized and diffuse. وأخدنا diffuse suppurative inflammation بالتفصيل في المحاضرة اللي فاتت مع الفate والcomplications of acute inflammation. طيب what are the effects of acute inflammation؟ يعني هو acute inflammation ده ربنا خلقه بيحصل ليه؟ This type of inflammation has beneficial effects and harmful effects. خلينا نبتدي بالbeneficial effects of inflammation. The first is dilution of toxins by inflammatory exudate and allow them to be carried by lymphatics. تاني حاجة entry of antibodies. لما تطلع الانتيبوديز من الcirculation due to increased vascular permeability اللي بتحصل وعرفنا انها بتحصل في acute inflammation ازاي. The pathogenesis of acute inflammation, it allow entrance of antibodies to extracellular space. طيب لما تطلع الانتيبوديز it combines with the antigen producing antigen antibody complex, okay, leading to complement activation. وفي الفاينل products حاجة اسمها membrane attack complex اللي هو C5-9 وده it will lead to killing and degradation of the harmful pathogen, وده طبعا من beneficial effects اللي بتحصل due to complement activation. And it will lead to neutralization of toxins when these antibodies combine with the toxins. The third is delivery of nutrients and oxygen عشان بيحصل vasodilatation زي ما اتفقنا في pathogenesis of acute inflammation. It will deliver more oxygen and nutrients to the site of injury, and it allow drug transplant. يعني الدراج اللي بياخدها البيشنت بتوصل اكتر للمكان اللي فيه inflammation برضو علشان فيه vasodilatation والمكان ده congested ومليان blood. تمام. Fiber information impede the movement of microorganisms and trap them, then enhance the phagocytosis. تمام. The sixth is stimulation of immune response via drainage of inflammatory exudate. It will allow particulate and soluble antigens to reach the lymph nodes, thus stimulate immune response. And it may lead to preparing the tissue for repair طبعا at the end of acute inflammation. ده pave the way for healing and repair to take place. طيب now we'll talk about the harmful effects. ايه الeffects اللي بتعملها الانفلاميشن and they are called harmful. First is digestion of normal tissue. تمام. Digestion of normal tissues في حالات الانفلاميشن بيحصل tissue injury via collagenases and proteases may digest normal tissue leading to their destruction, especially the blood vessels, and leading to vascular damage زي حالات glomerulonephritis. يعني glomerulonephritis they are inflammatory conditions affecting the glomeruli of the kidney. تمام. وبيحصل loss of these glomeruli لأن احنا عارفين glomeruli are tufts of capillaries يعني they are vascular structures. Swelling may be harmful. تمام. especially in certain sites زي الابيجلوتس. لو حصل swelling في الابيجلوتس it may lead to airway obstruction, especially in children, and it may lead to death. It's a fatal condition. When swelling occurring in the cranial cavity, it will lead to increase in the intracranial pressure, and it will affect the consciousness أو visual acuity of the patient. ويبقى ليها harmful effects تانية. يبقى swelling لو affecting certain organs, it may lead to life-threatening conditions. Inappropriate inflammatory response زي allergic inflammatory response may be life-threatening زي ايه؟ زي type 1 hypersensitivity reaction أو what's known as anaphylactic shock. تمام. It may lead to suffocation and death of the patient. Stasis and thrombosis may lead to extensive tissue damage. Finally, pain may restrict joint movement and leading to muscle atrophy. It may lead to لو في large exudation in the pericardium may disturb cardiac function. تمام. interfere with the pumping action of the heart. Release of the lytic enzymes from dead cells may extend the tissue damage. طيب دلوقتي احنا خلاص خلصنا acute inflammation. We are going to talk about the chronic inflammation. Chronic inflammation كان في comparison في المحاضرة الأولانية ما بين الأكيوت والكرونيك، we'll summarize برضو this differences at the end of this lecture. وعرفنا ان الأكيوت والكرونيك بيفرقوا عن بعض في ايه؟ في الأونست، من اسمها أكيوت تحصل acute onset، تمام، and it lasts for shorter duration، على عكس الكرونيك it has insidious onset and it lasts for longer duration. Let's define chronic inflammation. هو an inflammation of prolonged duration. مهم قوي ان الانفلاميشن ده بيحصل فيه 3 main processes at the same time. بيحصل active inflammation، بيحصل tissue destruction، وبيحصل healing, and these 3 procedures proceeding simultaneously. تمام. So the definition of chronic inflammation, it is an inflammation of prolonged duration in which active inflammation, tissue destruction, and healing proceeding simultaneously. What is the etiology of chronic inflammation? Chronic inflammation هيحصل يا إما following acute inflammation، لأن احنا أخذنا من complications of acute inflammation it may progress to chronic inflammation. يبقى first cause of chronic inflammation is following acute inflammation. When the tissue destruction is extensive and the bacteria survive and persist in small number at the site of acute inflammation، زي حالات الأوستيومايلايتس، النمونيا، it may lead to long abscess. The second etiology of chronic inflammation is recurrent attacks of acute inflammation. بيحصل acute inflammation and this acute inflammation heal and it recur and so on. When repeated bouts of acute inflammation culminate in chronicity of the process in recurrent urinary tract infection leading to chronic pyelonephritis, repeated acute infection of gallbladder leading to chronic cholecystitis. يا إما يكون الكرونيك inflammation ده de novo يعني it starts from the beginning as chronic inflammation، يعني not preceded by acute inflammation. de novo كده يعني في كلمة بتتقال كده جديد نوفي، يعني هو starts من الأول as chronic inflammation. تمام. Intracellular microbes when are of low toxicity but evoke immunological reaction, especially في certain types of bacteria بتعمل كده اللي هي tuberculous bacilli أو TB bacilli and some viruses. These bacteria or these types of viruses, when it infects any body, it's the effect of these bacteria or viruses will be chronic inflammation from the start. Immune reaction, particularly autoimmune diseases، تمام، in certain autoimmune diseases، وهناخد الكلام ده كله بالتفصيل في immunology lectures. Prolonged exposure to non-degradable but potentially toxic substances زي السيليكا والاسبستوسس. يبقى كل دي situations اللي ممكن يحصل فيها chronic inflammation from the start or named as de novo chronic inflammation. What are the general features of chronic inflammation? احنا في الأول خالص اتفقنا إن في inflammatory cells characteristic for the acute inflammation وفي inflammatory cells are main players في chronic inflammation. وعرفنا ان المين acute inflammatory cells اللي هم النيوتروفيلز والchronic inflammatory cells اللي هم lymphocytes and macrophages. فvery characteristic ان انا الاقي في حالات الchronic inflammation يبقى في mononuclear cellular infiltrate. Chronic inflammatory lesions are infiltrated by mononuclear inflammatory cells like phagocytosis and lymphoid cells or lymphocytes، وقلنا هم دول المين players or the main chronic inflammatory cells في اي chronic inflammation. بيحصل tissue destruction or necrosis، تمام. Tissue destruction and necrosis are central features of most of chronic inflammatory lesions زي ما أخذنا في definition. Proliferative changes as a result of necrosis بيحصل proliferation لل small blood vessels and fibroblasts leading to the formation of what's known as granulation tissue. هنعرف يعني ايه granulation tissue في الهيلينج and repair بالتفصيل، بس هو granulation tissue is composed of proliferating fibroblasts and small blood vessels. وده طبعا بتبقى الفيرست او الانيشال ستيب of healing. Eventually healing by fibrosis and collagen laying takes place. ده هنا عندي tissue section او photo for a tissue affected by chronic inflammatory cells. وعرفنا ان المين chronic inflammatory cells are the lymphocytes. Lymphocytes are these cells that we can see only the nuclei because these nuclei are surrounded by very thin rim of cytoplasm واللي بقدر اشوفه just the nucleus of these lymphocytes. تمام. We can see these large cells that have vesicular nuclei that are the macrophages. Systemic effects of chronic inflammation. It may lead to fever. Invariably there is mild fever, often with loss of weight and weakness, Anemia, chronic inflammation is accompanied by anemia of varying degree. Leukocytosis, it is in acute زي ما بيحصل في acute inflammation. Chronic inflammation also has leukocytosis, but generally there is relative lymphocytosis in these cases. بيحصل elevated ESR levels اللي هو erythrocyte sedimentation rate في كل حالات الكرونيك inflammation. Amyloidosis, long-term cases of chronic suppurative inflammation may develop secondary systemic AA amyloidosis. وفي lecture بحالها هنتكلم فيها عن الاميلودوزس. طيب زي ما قسمنا الاكيوت inflammation into suppurative و non-suppurative, الchronic inflammation will be classified into chronic non-specific inflammation and chronic specific inflammation. طيب أنا دلوقتي chronic specific inflammation ليها اسم تاني اللي هو granulomatous inflammation. تسمى بتاني chronic non-specific inflammation when the irritant substance produces a non-specific chronic inflammatory reaction with the formation of granulation tissue and healing by fibrosis. It is called chronic non-specific inflammation زي حالة الكرونيك osteomyelitis. بس اتفقنا لو هو chronic specific inflammation بيبقى اسمه chronic granulomatous inflammation، وهنعرف ايه هو بالتفصيل في السلايدز اللي جايه. In this condition, the injurious agent causes characteristic histologic tissue response by formation of granuloma. اوكي، زي حالات التوبركلوزس، الليبرسي، السيفيلس، الاكتينومايكوزس and sarcoidosis. طيب خلينا نعرف بقى ايه هو الجرانيولوماتس انفلاميشن. كلمة جرانيولوما، اوما في حد ذاتها، كلمة اوما لما بتتحط السفكس ده على اي word او medical term بيبقى معناها ماس. جرانيول يعني جرانيول، small granules، يبقى انا عندي masses او small granules under the microscope بشوفها or even grossly. هنشوف الديفينيشن. It is defined as a circumscribed tiny lesion about 1 millimeter in diameter composed predominantly of collection of modified macrophages called epithelioid cells and rimmed at the periphery by lymphoid cells. احنا الكلام مش بيختلف خالص عن اللي احنا كنا لسه بنقوله دلوقتي، ان الchronic inflammatory cells are mainly lymphocytes and macrophages, and we have these granulomas are composed of again macrophages and lymphocytes. بس الماكروفاجز هنا عندي in an inactivated form اسمها epithelioid cells، وهنعرف شكلها ايه. So the word granuloma is described from granule meaning زي ما قلت لكم circumscribed granule-like lesions, and the oma, which is a suffix commonly used for true tumors, but here it indicates a localized inflammatory mass or collection of macrophages. تاني, what is the definition of granulomatous inflammation? It is a specific type of chronic inflammation. يبقى احنا قلنا chronic inflammation لما بيبقى specific اسمه granulomatous inflammation. It is characterized by localized nodular small masses or ranges from a size بتاعها from 0.5 to 2 millimeter in diameter, formed mainly of احنا قلنا عشان ما نحفظ ان chronic inflammatory cells are macrophages and lymphocytes. These granuloma formed mainly of aggregates of activated macrophages that are transformed into epithelial-like cells اسمهم epithelioid. كلمة epithelioid هم actually they are not epithelial cells، زي ما قلنا هم nature بتاعتهم هم activated macrophages. ليه سموهم epithelioid؟ علشان oid معناها ان هي شبه، so they are epithelial-like cells. شبه الابيثيليال cells في ايه؟ ان الactivated macrophages زي ما احنا شايفين هم دول، تمام. Here we have aggregate of activated macrophages or the epithelioid cells. These cells have plumpy, تمام, oval nuclei, vesicular and surrounded by abundant pink cytoplasm. وده شبه جدا، بيخليها جدا يعني شبه الابيثيليال cells جدا. So they named as epithelioid cells. Surrounded by a color of lymphocytes. يبقى here we have this pink aggregate اللي احنا شايفينها اللي هي عبارة عن ال aggregate of activated macrophages or the epithelioid cells, surrounded by a rim of these small violet cells اللي هو لونها أغمق كده. دول اسمهم color of lymphocytes، واتفقنا ان الليمفوسايتس ما بيبانش منهم غير النيوكلياي under the microscope لان هم surrounded by very thin rim of cytoplasm، وده بيديني الامبريشن ان انا شايفه جزء لونه dark violet surrounding the epithelioid cells. What is the pathogenesis of granuloma? Formation of a granuloma involves engulfment of the invading agent by the macrophages, failure to degrade the antigen, morphologic change of macrophages، تمام، تتحول زي ما احنا قلنا بيحصل لها activation تتحول epithelioid cells and the incoming CD4 positive T cells, which elaborate various cytokines which contribute to proliferation and activation of cells. تاني, this is diagram when we have a cell injury via TB bacilli مثلا, اللي هي اصلا one of the bacteria اللي اتفقنا ان هي it induces granuloma from the start or chronic inflammation from the start. تمام. when the body failure to digest the antigen بيحصل weak acute inflammatory response وبيحصل engulfment of this pathogen by the macrophages with persistence of the injurious agents بيحصل T cell mediated immune response, poorly digestible agent leading to the activation of CD4 positive T cells and the release of certain cytokines. This will cause chemotaxis and proliferation of other inflammatory cells, and it would lead to macrophage activation and transformation of these macrophages into epithelioid cells. وعرفنا يعني ايه epithelioid cells وليه اتسموا epithelioid cells. Okay, and secretion of fibroblastic proliferation cytokines وبيحصل بعد كده proliferation of fibroblasts. يبقى انا عندي بيحصل active tissue destruction وبيحصل في نفس الوقت healing process, وده من الكرايتيريا of chronic inflammation زي ما اتفقنا. Again we have a diagram هنا عشان يقول لي ال composition of the granuloma. قلنا هي عبارة عن ممكن central nidus of or central focus of necrosis surrounded by epithelioid aggregates or epithelioid cells, and we have the outermost layer are the color of lymphocytes. طيب activated macrophages قلنا ان هم اسمهم epithelioid cells and they are the pathognomonic cells of granuloma and they have abundant pale pink cytoplasm. تمام. These are the epithelioid cells and the activated macrophages. Very important to know that they are the pathognomonic. Pathognomonic يعني cells اللي بتميز الجرانيولوما under the microscope. What are the types of granuloma or what are the etiologies of granuloma؟ ايه اسباب الجرانيولوما؟ ممكن تكون infective causes او non-infective causes او even unknown causes. The infective causes bacteria. تمام. ممكن تبقى بكتيريا زي قلنا تي بي باسيلاي, syphilis. ممكن تبقى parasitic infestations زي الشيستوسومايسيس اللي هي البلهارزيزيس. دي fungal infection as histoplasmosis. لما بيبقى الاتيولوجي بتاعي non-infective ما عنديش لا بكتيريا ولا فيروس ولا فنجاي ولا parasites, يبقى الانسايتنج ايجنت بتاعي in organic metals and dust زي السيليكوزس او السيليكا particles بتعمل لي what's known as foreign body granuloma. If the etiology is unknown, وفي مثال شهير على كده هو الساركويدوزس. طيب ممكن one of the components of the granuloma احنا اتفقنا ان انا عندي بيبقى ممكن الاقي central area of necrosis surrounded by aggregate of epithelioid cells and the outermost layer will be the color of lymphocytes. ممكن الاقي cells كبيره زي دول زي ما احنا شايفينهم كده, احنا شايفينهم كبار, so they are named giant cells, الخلايا العملاقه. تمام. These cells or these giant cells are formed due to fusion تمام of the epithelioid cells. يعني ممكن شويه epithelioid cells fuse together and they form these large multinucleated يعني they have multiple nuclei زي ما احنا شايفين, and it results from fusion or aggregation of epithelioid macrophages. طيب according to the arrangement of the nuclei within these cells لو النيوكلياي دي arranged in a horseshoe shape or a U shape زي ما احنا شايفين يبقى واخده شكل حدوة الحصان كده, يبقى اسمها Langerhans type giant cells. Langerhans type giant cells مش Langerhans بليز, Langerhans مش Langerhans, خلينا بس ايه ناخد بالنا لان Langerhans دي cells موجوده في البنكرياس زي ما احنا عارفين. ف the name of these cells will be Langerhans type giant cells and they are characteristic of TB. لو these nuclei are haphazardly arranged within the cytoplasm they named as foreign body giant cells. طيب at the end of the lecture we are going to sum up the differences between acute and chronic inflammation. As regards the duration اتفقنا ان acute inflammation it has a short duration, it may last for days, while chronic inflammation من اسمها chronic it lasts for longer duration, ممكن توصل ل weeks or months. The onset is acute في حالات acute inflammation and it will be insidious in chronic inflammation. Specificity usually the acute inflammation is non-specific, انما الchronic عرفنا ان في types specific chronic inflammations اللي هما الجرانيولوما. تمام. The cells قلنا the main players او the main inflammatory cells في حالات acute inflammation mainly neutrophils, وبتيجي الماكروفاجز at the end to pave the way for healing زي ما احنا عرفنا, وبتعمل الفاجوسايتوزس. في الكرونيك inflammation mainly the main players عندي هتبقى lymphocytes والماكروفاجز. plasma cells and fibroblasts will have a role in chronic inflammation, بس main chronic inflammatory cells are the lymphocytes and macrophages. What are the vascular changes اللي بتحصل في الacute inflammation والchronic inflammation؟ في الacute احنا اتفقنا في الباثوجينيسيس بيحصل الأول transient vasoconstriction followed by vasodilatation and followed by increased vascular permeability. While in chronic inflammation اتفقنا ان بيحصل proliferative changes من ضمنها formation of new blood vessels وده اسمه angiogenesis. exudation and edema. الاكزوديشن والإديمة بتحصل اكتر في الاكيوت لان بيحصل vasodilatation و increased vascular permeability. وال increased vascular permeability allow the passage of plasma proteins وبتعمل لي الاكزوديت which is a protein rich fluid زي ما اتفقنا. The cardinal signs of inflammation بتحصل في الacute inflammation وسميناهم اللوكال cardinal signs of acute inflammation while إنها ما بتحصلش في حالات chronic inflammation. The tissue necrosis. Usually tissue necrosis is negative except in suppurative inflammation. تمام. While in chronic inflammation usually it is associated with necrosis. fibrosis acute inflammation usually negative بس زي ما اتفقنا ان fibrosis ممكن يحصل في الاكيوت inflammation مع السبيوريتيف inflammation. fibrosis هو السكار formation. الchronic inflammation usually associated with fibrosis. تمام. systemic manifestations بتبقى موجودة اكتر في الاكيوت in the form of high fever. في الchronic بتبقى in the form of low grade fever, weight loss and anemia. changes in peripheral blood. تمام. في الاكيوت بيبقى معايا عندي increased neutrophils او neutrophilia, lymphocytosis in viral infections. في الchronic inflammation بيبقى عندي frequently non-variable leukocyte changes. Thank you. هكون سعيدة جدا لو اتفضلتوا عندنا وبعد ما ذاكرنا المحاضرة دي تسألوا في أي حاجة في الباثولوجي في المحاضرات اللي أنا اديتها أو في غيرها. شكرا لكم جميعا وجود لك يا دكاترة.